I'm Dr. Jessica Seaman, Assistant Dean for Faculty Development in Creighton School of Medicine. And thank you for joining us for our very first Planetary Health and Sustainability session here in Phoenix. I really want to thank our 3 students that are in the Planetary Health Interest Group. So Juan Shin, Isabella Locke, and Kathleen Zhu. They did so much behind the scenes to get things organized and set up, and I really appreciate all the work that they did. Today's session is Heat, Air Quality, and Human Health, Global Challenges, Local Solutions, presented by Dr. Jennifer Vanos. And I do have a few housekeeping items before I introduce our speaker. The session is being recorded, so you will have access to the recording and the slide presentation for future reference. We do invite you to ask live questions or submit them in the chat for those on Zoom, and we'll get to as many as we can by the end of the session. For those on Zoom, we do ask that you remain muted and video off unless you're asking a live question, just to assist with the recording. And also, the session is eligible for CE credit for faculty that need that CE credit, and you will receive the website and activity code by the end of the session. There is a short survey associated with the continuing education, and we thank you in advance for letting us know how things are going so that we can continue to provide robust and diverse programming here at Creighton. Now to introduce our speaker. Dr. Jennifer Vanos holds an interdisciplinary appointment studying climate and human health in the School of Sustainability at Arizona State University. As a human biometeorologist, Dr. Vanos also works to strengthen the understanding and practice surrounding how we protect people from extreme heat and air pollution. We are so grateful to Dr. Vanos for sharing her time and knowledge with us today. So Dr. Vanos, if you're ready, I'll turn it to you.
Okay. You guys can hear me all right? Okay. Hi, everyone. Thanks for having me here. This is a really good crowd size. Excited so many people made it. And I know that a lot of you are students in some area of health sciences, so that's exciting. I hope that my talk can bring some new ideas and new research projects to you that you might actually use in your studies and career someday. So yes, I'm in the School of Sustainability at ASU. I do a lot of interdisciplinary research, and I'll be talking about that today. Before ASU, I was at UC San Diego as an assistant professor, joint between working on climate and weather and then in the School of Medicine. So I got some really good exposure to how people who work in the School of Medicine approach some of these issues differently than people who might work in the climate world. And that's actually been really beneficial to me as I'm trying to work across disciplines and translate some of our research or findings to other people. And health practitioners are really important people to be talking to and working with. So I'm eager to also hear what you guys think about some of this too, and get your questions at the end. So I also often get the question, what is biometeorology? And if you can simply put it as we, as human biometeorologists, study how weather or climate impacts human health and well-being. There's plant biometeorologists and there's animal. I study humans. And so in my lab, we work to strengthen society's ability to manage, mitigate, and or adapt to extreme heat and air pollution. My main focus, though, is extreme heat, especially since coming to ASU, as the climate is changing. So I use field and lab sensing tools, make sure that I try and make sure that all of the studies I do have applications to human health in some way, whether that's using epidemiological data and studies in that sense, or studying people in a specific time and place, such as children on a playground. And so I'm always kind of solutions focused. But what's really fun too is I get to work across these various disciplines. I love working with thermal physiologists. I can do the climate change stuff. I'm a biometeorologist at heart, but we also have to have that public health focus in there and make sure that we're serving the populations, especially the populations that need this work most. So with heat and air pollution, there's some unique aspects of heat and air pollution that you don't find in other hazards like hurricanes and tornadoes. They're silent, they sneak in, they're invisible to our eye for the most part. So we can look outside right now and we wouldn't know whether or not it's a heat day or it's a beautiful day, which it is a beautiful day for this time of year for Phoenix, or if we have an air pollution warning. We need to get information from other places to make decisions about our day-to-day behavior. We might be able to climb up Camelback and see the inversion layer of PM after a bad day or after some fireworks or and whatnot. But it's invisible to us, and it by slow moving, I mean these heat waves and air pollution events often coincide, come in together and plop down and stay in our region for a while. And we have a valley here. And when you have valleys, oftentimes sinking air traps pollution inside. And we see that especially in the mornings before the surface is heated up to break up the inversion layer. When we think about variability, it's what's hot here is not necessary, or would never occur in New York. And what's hot in New York wouldn't be hot for us on average. So there's this variability too in terms of what the exposures are and how the population is trying to adapt to these exposures or has adapted to the exposures over time. So I'll get into a few more of those examples today. The health impacts are differential, so we can think about different types of populations, children all the way to people who are considered elderly, so over 65 years of age, and think about how their exposure is different, how their bodies are maybe not primed for being exposed to these because they have underlying medical conditions or just haven't fully developed yet. And then we know it's deadly. Both heat and air pollution are deadly. They're global issues. But overall, especially with heat, the deaths are preventable. So we shouldn't be seeing heat-related deaths. We know how to prevent those. We know why people die of heat. But we see far too many, especially in our region each year. And with air pollution, it's a much harder, more variable phenomenon that we see a lot of deaths in kind of the developing countries as well. So when we think about premature deaths, I'm going to keep hiding this. With air pollution, we know that globally in regions that are using air pollution sources such as fuel sources such as using firewood indoors and burning it for their source of heating or cooking, that becomes a really big problem. We see that a lot in India, for example, or they might be burning firewood that is wet and not ready to be burnt. And that causes incomplete combustion and a lot of problems for indoor air quality in those regions. With China, we can think about the coal-fired power plants and other forms of incomplete combustion that are going on in the country, where we do see these areas that there's a lot of deaths that are occurring prematurely, directly attributed to air pollution. And it happens in every country, but those are the two countries that stand out there. In the US, we do have better air quality than a lot of places in the world until fire season comes, and then you start to see the purples pop out, where the air quality in Berkeley is just as bad as the daily air quality in India. And that can really make you think what it would be like to live through that every day and how detrimental that could be to someone's lungs. All right, okay. That's why. Okay, so then one of the things we know is that there's a lack of air pollution monitoring globally too. So I can show you that map of attributed deaths, premature deaths to air pollution, but it's very hard to know exactly what their air pollution exposure was when we don't have sensors in enough places. And you can see there's a big push towards using more community-based sensors to get data. This is an example of Clarity Open Map. There's purple air sensors as well that people are using. But it's showing both the clarity sensors and the regulatory sensors that different countries run. And you can see US has great coverage. other countries don't have as good of coverage. And so platforms like this are trying to make air pollution data more available so that we can better understand exposures and health response, because there's a lot of gaps globally where we don't know that. And similarly with premature deaths due to heat, we have to think about where do we have data, where can we understand what the exposures and response are, and where do the most vulnerable populations live and the highest populations. So these are not percentages, these are not like magnitudes of deaths. And so you're going to see the highest magnitude in the most populated regions of India and China. And so that pops out again as heat being a big problem, but we see it in the news all the time. India has already experienced a lot of heat waves this year. It's been in the news around how they're fasting for Ramadan and how that puts their population more at risk. And so understanding those cultural practices is really important as well. Just thinking about what kind of adaptive capacities do they have in play to be able to escape the heat. And again, when we look at where we have coverage of data globally, we are much better for having coverage in terms of the meteorological data compared to air pollution sensors. But what I'm showing you here is where we have mortality data on heat. So the purple circles show where we actually have mortality data on heat. And what you can see is in the global south and the low and middle income countries, there's very little mortality data that we have on heat to actually be able to say, we know there's a relationship in this location with heat and human health. So there's a huge lack of human health data to be able to draw these conclusions. And a lot of our data come from developed countries. So in the US, in Canada, in a lot of the European countries, you can see South Africa there, where we're getting some good human health data to connect with meteorological data and make those associations. If we don't have the data, we can't draw conclusions. And so there's a big push too to how can we do this better and have good health systems that are collecting systematically the good data. And you'll see soon that Maricopa County in the US is one of the best counties for collecting data on heat-related illnesses. So there's a lot of interactive effects between heat and air pollution that we see. And we know that extreme heat days and extreme air pollution days often coincide, again, related to the meteorological conditions that cause both to occur. And that's very common in Phoenix, where the best predictor of poor air quality days, aside from a haboob or fireworks occurring, is the weather. And so the air quality department is using weather forecasts, back trajectories to be able to predict what the meteorology will be like and to make decisions on things like controlled burns and whatnot that we have to be doing. So this is an example in Moscow. In 2010, 55,000 deaths occurred. It was a heat wave, and this is what the air looked like. And so one of the challenges in this space is being able to separate if someone went to the hospital and they were sick or they died during this event, was it due to the air pollution or was it due to the heat? And we know that respiratory deaths can be respiratory issues can be exacerbated by both. And so it's very tough to tease that apart. But when we do see these interactive effects between the two, we do see more deaths occurring. So we can look back to 2020 and think about the cascading impacts and compounding threats we saw, not just the issues with COVID and not having the social connections because you had to isolate, and then seeing fires throughout California and not knowing where to go, and then also maybe not having access to cooling centers or your own cooling. So there were all of these new challenges and vulnerabilities happening, and what we're seeing more and more of is that these compounding or cascading impacts from one disaster to the next are happening. So we can think about Hurricane Irma hitting Florida, and then right after that, when everyone lost their power, there's a big heat wave. And that's a cascading impact. Happened with Harvey too. And we have to think about how can we be more prepared for that? And how can we understand where the most vulnerable populations are, such as people in nursing homes that are being flooded? We need to get them out. If we can't get them out, what are we going to do to protect them in that location? Thinking about how to make sure that there's resilience hubs open so that when we do lose power in a heat wave, people have somewhere to go, because we don't know how long that could be. So there's a lot of opportunities here for cross-disciplinary collaboration and talking to each other to figure out what are the solutions in these really terrible events. And then with the wide-ranging variability point, I think I gave some examples of how it differs globally and locally, but thinking about even what people wear to the type of climate they have, we have a pretty dry climate here, and that's very different than what they're facing in the Persian Gulf or Houston or Florida, which means some of the solutions will differ as well. And in our studies, we really try and make sure that we are understanding the impacts to the most vulnerable populations versus only looking at the average person, which maybe doesn't necessarily exist. And in a lot of heat and health modeling, what people look at is the average white male who is healthy and acclimatized, and that doesn't really exist in society. So I think one of our main points is that if we want to be able to help the most vulnerable populations, we need to be able to measure and model the most vulnerable populations, and there's a lot of lack of data there. So when we think of population vulnerability, we can look at, the pregnant woman and the baby all the way up to being elderly or being tied to help from a machine in your home or in a hospital. And being able to look across that lifespan is really important versus just looking at one point in time for healthy populations. And so then when we're trying to address, is someone going to be more vulnerable to heat, for example, we need to understand body composition. We need to understand what medications they might be taking. There's a lot of studies now going on trying to understand how something like antihistamines, certain drugs taken for depression affect thermoregulation, so that medical doctors can be aware of higher heat risks in some of their populations. This is still a wide open question, and it's very hard to get IRB approval to do these studies, but they tend to be done in a chamber in a safe way. And you're going to start to see, does someone's core temperature start to rise sooner and faster who are on a certain medication than someone else's? And so this is a very active area of research that we need to understand how it's affecting sweating or the ability to circulate blood to the skin. And then acclimatization. So thinking about how acclimatization is going to support our cooling mechanisms to support the heat loss from the skin and heat loss from sweating. And then age, and this is a crucial one. A lot of our studies show that age is a much more important predictor of vulnerability to heat extremes in the future than any change we're going to see in the climate. So if we have a changing population an aging population, and we're seeing a lot of the boomers are going to be over 65 or are already getting there, and we see this huge shift in demographics, we have a much more vulnerable population, and that shift in demographics is going to put higher stress on the healthcare system than just seeing this 1.5 degree increase in air temperature, right, throughout the world. And so we're trying to be able to convey that it's not just the air temperature that matters, it's the vulnerability that matters. So now let's zoom into Maricopa County and see what we've seen over the last few years. These are the number of heat-associated deaths per year, most of them occurring between May through September, October. And you can see this big rise since about 2015, 2016. And in the last couple of years, a lot of this rise is attributable to housing insecurity, and therefore people not being able to find the resources and the cooling they need. It also can be connected to issues related to illicit drug use, so thinking about the fentanyl or opioid crisis, and how those drugs can also affect thermoregulation or someone's perception of the heat they're experiencing in their body, and then what to do when they're experiencing that. And so it's very tough to tease apart all of the reasons we're seeing this, but a study that was done by colleagues of mine at ASU looked at this 2016, like from 2015, 16, and so forth. And what they looked into was there was a spike, but it was a spike of a spike at the time, right? At the time, it was a spike. It's not considered a spike anymore. But what they found was that even though deaths went up, the air temperature that summer was quite a cool summer for Phoenix. And so their conclusion was it's not the heat, it's the vulnerability. And what they saw was there were a greater number of vulnerable populations being exposed to heat for longer periods of time. So that's, I think, a main message that hopefully that sticks with you and gets across. So who are we seeing suffers the most? Hospitals do get a lot of extra emergency department visits or hospitalizations during heat waves. We know that more women are vulnerable indoors and tend to die indoors, whereas more men are vulnerable outdoors and tend to die outdoors. And that 40%, as of this data, which I think is up to 2019 when they made this nice infographic, was 40% indoors, and a lot of those in mobile home units. So what could we do with some of this information? Could there be questions that could we ask people, what's your home life like? Or if a child might be struggling in school and not getting enough sleep due to the heat, what's their home life like? Are there resources? We work with the schools a lot. Are there resources that could help them out to make sure that they're getting whatever could be available from the state or federal resources to help with weatherization, cooling, fans, air conditioners, and so forth? But then the question comes, can you pay for the power, which I'll get to in a minute. We also know that a lot of deaths occur when the minimum temperature overnight is above 85 degrees Fahrenheit. So we've all, and it happens here, but it happens worse in other cities that are more humid, but we still see, we'll go outside at 11 p.m. or midnight, and it's still so hot out, and you feel that heat rising off the street. And so when we have these extended periods of high heat, we see more deaths. So that's just a few of the data. And yeah, you see 70% of the deaths are when they're 50 years or older, and therefore a little bit more at risk. So we can think about how are people exposed to heat and what mediates those exposures. So we try and get at personal heat exposure, and we know that connected to that is the built environment and all the infrastructure systems we have around people. We're sitting in a nice new building, I think, with good air conditioning, and that is a piece of the built environment and the infrastructure and technologies in place to help us adapt to heat. What are people's behavioral and social factors? Who's going to their neighbor's house when their air conditioning dies? What are people doing when they start to experience negative thermal comfort? Do they know what to do, or is that affected by potentially some medication or drug that they are taking that can impact their ability to perceive that they are overheating? Outdoor and indoor ambient heat. So we often just say, here's the airport temperature, and therefore everyone in the city is exposed to this temperature. And that's what an epidemiological study here is going to do. They're going to say a 1 degree rise in temperature is equal to a 10% rise in heat-related mortality, for example. And that air temperature is coming from one station in the city, and it doesn't tell us anything about what people are exposed to indoors. So while it's good to be able to see that so that we can say on hotter days we expect to see more deaths, it doesn't tell us too much about the kind of indoor environments that people are exposed to when we know people spend 90% of their time indoors, and higher if you're here in Phoenix in the summer. What public health and systems and interventions are in place to help people? And this is probably where you guys are thinking, like, what is in place? What do we do to maybe help people? There's a lot of support systems that I know U of A has this task force that goes out to the Human Services campus and will help give people kind of resources and cooling that they need, and then also help with drug overdoses and people who are experiencing that in the face of heat wave. The city of Phoenix recently created the first ever publicly funded Office of Heat Response and Mitigation. And that response piece means going out in the summer when it's hot, and it's always hot, and helping people who are most vulnerable stay safe in the heat, and then also trying to help them find shelter if they want it, and not everybody wants it. So then that gets to the personal heat exposure. What susceptibilities do people have? So you're exposed to heat, but my experience in the heat might be different than your experience in the heat, and how you perceive it, and then what's happening to our sweating system and so forth based on our acclimatization and our overall personal fitness level, for example. So that you can have the personal heat exposure, but the way someone responds to it can still be different. And then we get to potential adverse outcomes. So when we try and think about different type of people and how they're kind of navigating their environment, we can look at a neighborhood heat sensitivity profile and say we have people who are very vulnerable and people who are not very heat sensitive and people who are not. So someone who has their heat exposure going up as the air temperature goes up is going to be more heat sensitive, because that means they're not buffered from the elements outside. And you could say the same thing with air pollution. If people live more outdoors or in buildings that are not well weatherized and have poor ventilation, then you're going to see their personal exposure to air pollution rising as the air pollution outside rises. But in a building like this, that's filtered out, and we have good mixing systems to make sure that the air pollution levels indoors are lower than the air pollution levels outdoors. For someone who has the means to cope, then, and they can set their thermostat at 75 degrees, then this is a heat insensitive person. And for those people, heat is more of an inconvenience. For these guys up here, heat, I don't know if that's gonna work. Heat is going to be more of, it could be a disaster for their lives, or it could be something they need to budget for day after day after day, being like, how much cooling can I use? Oh, what about the water? Am I going to trade off water for cooling today? And that's a completely different situation than what someone who is going to from their air-conditioned car to their air-conditioned home to their air-conditioned office is experiencing. And so we need to be able to look at the population differently and understand who we're working with. And we want to take those heat-sensitive neighborhoods and bring them down and find ways to provide them coping resources to adapt. So this is just a little schematic of how we think about the body and how it's experiencing all the different avenues of heat gain and loss. So for some of you, you're like, yeah, I know we lose heat through sweating and we lose heat through convection. But when we bring in the meteorological pieces, we have to add in how much heat are you gaining through the sun? How much heat are you gaining that's coming off the grass or coming off something like dark asphalt? How much heat are you gaining through metabolic rate? So the more exercise you're doing, the higher your budget is. And then you want to be able to lose that. So you start sweating. If the air temperature becomes higher than the skin temperature, then you're going to start gaining heat from the environment. And we do get into those situations here in Phoenix, and that can be very dangerous. But our saving grace, especially before the monsoon comes, is that we can pretty much evaporate as much sweat as we want because it's so dry. We are just limited by the amount of water in our body to evaporate. So we need to stay hydrated. So if we get into a situation like in Houston or the Persian Gulf, where it's so hot we can't lose heat through convection, and it's so humid that we're barely evaporating any sweat from our skin because it's dripping off, we call that inefficient cooling or evaporation, then it becomes super dangerous. Then we need to find ways to find cooling, to bring in fans, because a fan is going to support the evaporation of that sweat. And that's why we like the feel of fans when it's really hot and sticky, because it's supporting sweat evaporation. And normally throughout the year in Phoenix, we have really good support of sweat evaporation. But especially last year with the monsoon in like September, it was so humid, and it was my first summer experiencing a true monsoon here, I think. And I went, okay, Phoenix isn't always hot and dry. And we really need to look at like the June, July-ish periods different than the August, September-ish periods when we're thinking about heat mitigation and personal cooling in our city. So when we get into a situation we call uncompensable heat loss, meaning we just can't lose enough heat for the amount of heat we're creating, that is when we see potential core temperature rises, and it can be really dangerous. We can stay in steady state as long as we're not creating too much heat versus how much our body can lose. And so this is I hope you guys like this, is like coming from health sciences, but my colleagues and their thermal physiologists and I put this together to demonstrate in one of our Lancet articles on heat. And it was I need to change this slide. So this is, I can share this paper, it's open access, but trying to demonstrate there's three main ways you can die of heat. And so thinking about all the things that are happening in the body, but the main way we die of heat is not through our core temperature getting too high, it's through our heart trying to work so hard that it can. And so that's why we see people with cardiovascular disease end up in the hospital or passing away from heat exposure because they already had an infirmity in their heart and their heart couldn't get the blood it needed to the skin, for example. And that can be exacerbated when we're dehydrated. And then if someone has poor kidney function already, then we potentially see kidney deaths. But that's not like the most common one in epidemiological studies is going to be cardiovascular deaths. And the core temperature isn't going to have gotten that high. It's when the body was trying to thermoregulate and it couldn't handle it. And so, and then there's the cascade too of thinking about what happens when the core temperature does get to like 107 or so or higher, 108, and what's happening in the gut and with kind of the whole cascade that can shut down organs. But the most vulnerable we talked about already, and thinking about how the 3 different ways that you might succumb to heat affects these people. And like, so workers in the heat have a lot of kidney issues because they've experienced dehydration so much in their jobs. And there's a lot of social reasons and like labor laws that need to be put in place to protect those populations. Socially isolated, so people who just don't know who to call or where to go, and we talked about those things. So I'm going to give 2 examples of what's kind of examples of social vulnerability, and get now into new adaptation strategies that we can see being used that are helping. So some of you might have heard of this story, but this is Stephanie Pullman, and she was she's from the Phoenix area, and she couldn't pay $30 or so of her air conditioning, like her energy bill. And so they shut off her energy on a 170-degree day. APS cut power to her home, and she ended up dying. Her daughters didn't know, and her daughters lived in Ohio, at least this daughter did. And of course, if she had known, they would have paid it for her. So you can think of all of the kind of things that could have happened for Stephanie in terms of maybe she didn't want to ask for money, maybe she didn't realize she was experiencing the detrimental effects of heat so bad. We get confused, we get dizzy, we sometimes like, and for people who've experienced heat stress, heat exhaustion, that's kind of, you almost feel a little bit drunk, right? Like you don't know what's going on, you start to feel nauseous, you get headaches and so forth. And so sometimes you're just unaware. And so what happened after this is that APS and I think SRP2, they're not allowed to shut off people's power just because they can't pay their bills in the summer to avoid people dying this way. That doesn't mean that the homes don't have to pay their energy bill later on. And so while hopefully it's caused less death, it's still this problem. October rolls around and these huge bills come in, and then people can get their electricity shut off. And so this has been ongoing since this occurred, I think in 2019, to figure out what are the cutoffs, what can APS or SRP do in an ethical way and they're creating more programs to support people with weatherization and air, like how can they help people with paying their bills and thinking about the time use and everything to support people with that. Another example where we see heat deaths far too often that are completely preventable is in youth sports, specifically high school football players. This is an example, and this is exertional heat illness, very different than what Stephanie Pullman experienced, which was classic heat illness. Exertional heat illness is when you're exerting yourself in the heat. And it's a different, it occurs very differently in terms of what the body is experiencing too, and some of the signs are different, but it was completely preventable. And what happened on this day, and this was in Texas, is the coach said, you're gonna run till someone drops. And Max dropped, and that ended his life. And so you can imagine the court cases after this. And this is all too common that it does happen. And who's in charge of watching the weather and making decisions for when football players can or cannot do certain types of activity? There's guidelines in place, but there's no set policy that says you must do this then. We just say, okay, in this environment, here, adapt the work, or they can wear less clothing or give them more breaks. And that happens in some places, but not everywhere. And so some of the work we're trying to do is train athletic trainers who have a lot on their plate already to think about heat and to be monitoring the heat and to be trying to make changes and work with the coaches to do that so situations like this don't occur. And the culture matters too here. But the other thing one of our papers drew out was thinking about what is modifiable in this situation and what is non-modifiable. We can't change the weather, but we can change their exposures by bringing them inside. We can't change the size or the sex of the person, but we can try and understand if they're taking medications or if they have an underlying illness at the time. We can change what they're wearing. So there's these modifiable and non-modifiable factors that we can start to consider. And as an example of something really good happening in this space for safety and adaptation measures for exertional heat illness, has anyone heard of the Corey Stringer Institute? Oh, and that graph is not showing up. Corey Stringer Institute is it's at University of Connecticut, and they were formed after Corey Stringer of the Minnesota Vikings died during a practice in the heat. I think it was 2006-ish. And so in honor of his life and for his mother, this institute was formed, and they do all of this great advocacy work and research, and have a heat chamber and everything to stop these sudden death in sports from occurring. So it's not just heat, they do concussion and so forth too. And I'm sorry, this one isn't showing up, but it's to show you that there are quite up to 7-8 deaths in football players each year across the country, but that has been dropping. Because, and this is kind of the pattern of it from a study in 2012, you can see a lot more over in the eastern side of the country where it's more humid, and maybe where the culture around football could be different too. But they are 100% preventable if they're treated properly, and there's a lot of education on this to support pre-hospital care for exertional heat illness, which means monitoring, but also having an ice tub on the side of the field. Because if someone is transported before they're cooled, they're most likely to die on the way to the hospital if they're experiencing exertional heat stroke. If they're cooled first and transported second, they're most likely to survive. And so the states that are employing this are shown here in the blue and orange. So orange for the sensors and blue for the ice tubs. And this doesn't mean, this just means that these states have signed on to put this into practice and potentially policy. That doesn't mean it's not happening here in Arizona. It could be happening, but it's more like school to school, and what school has the resources and who has an athletic trainer, because not everyone does. And it doesn't mean they don't know this and don't have it next to the field if this happens, but it's not formally enforced. And so we do see lower deaths as these are being put in place. The state of Georgia implemented monitoring and the cool tubs, and since then, no deaths have occurred in high school sports. So that's one example, and I would say this is a really nice example of using education and knowledge to create adaptation to heat extremes we've always experienced and that are only going to be worsening. And so when we think about adaptation, there's technology, infrastructure, behavior, and physiology. We've talked about all of those in different ways already. Physiological is that acclimatization. Infrastructural, we've talked about buildings and so forth. Technologies, sensors, or how can air conditioning is the most obvious one, but there's other forms of passive, more sustainable cooling that can be used. So as an example of thinking about how developed countries have adapted over the last 30 years or so, we can look at data showing that in nearly every prospective study, so climate change projections, they say we're going to see more deaths into the future for heat-related mortality. But in every retrospective study, studies report declining heat-related mortality in the developed countries where we have that mortality data. So what we're seeing is we do know in developed countries, we're using adaptation practices of various forms to decrease the amount of heat-related mortality happening. So there's this disconnect here where why do we see that everyone says it's just going to like shoot up and start increasing again? And it's because a lot of these studies into the future aren't accounting for adaptation, but they are accounting, some of them, for aging population, which will increase the number of people dying of heat, although hopefully not. So we want, and especially in low and middle income countries, so we want to be able to understand what we're doing right, how can we do that better, and who are the most vulnerable that aren't getting these adaptive strategies into their daily lives. Okay, I'm going to skip this one because I'm running out of time. Some local examples. So I'm just going to run through a few local examples of ways we're trying to use adaptation strategies and put them in place to try to mitigate heat or help people adapt to heat. So with teachers, we can talk to teachers and understand how kids are experiencing heat. And a lot say it's too hot to play. They might not be able to learn very well after they play. It might be too hot in the school. And so even staff members might be experiencing dizziness and heat exhaustion. So a few years ago, we created what we call heat-ready schools. And any school, especially here in Maricopa County, we're trying to see which schools want to be part of our heat-ready program so we can help them be more heat-ready. We know that there's certain risks in children that are higher than in adults, largely around physiologic or behavioral factors, and them having the capacity to make changes. So if the teacher says you can't go inside and there's no water fountain outside, then what do they do? Whereas an adult would just be like, I need water, I'm going inside. And the younger the kid, the more difficult it is. We know that more studies are coming out in terms of how heat can affect behavior and learning. And then both indoor and outdoor heat is a concern. In Phoenix, I think most schools have a rule you have to have indoor temperatures below 84 degrees Fahrenheit, but a lot of states don't have that, especially in California. So we do see emergency department visits directly related to heat throughout the year, and we see that rising starting in May to September. And a lot of school districts are going to a school system that starts early July now. I know Tempe is. And that's going to cause some bigger issues too. And can kids play outside? What can be safely done? And so we're working with schools to find strategies that aren't just saying like, keep kids inside all day and don't let them play, but how can we adapt recess? How can we make sure that people are trained and prepared in the face of a heat event? What are nurses doing to deal with this? Do you have a formal policy in place that says when the temperature gets up to this is the change that is made around physical activity and going inside, or for how long? Or do you have supportive environments outside that provide shade for the kids, for example? So we hear a lot from parents and teachers requesting more information and saying they're unaware of available resources made to them. So some know of them, but in terms of, so there's school heat safety alerts that the ADHS puts out, and more than half of our respondents did not know about those school heat safety alerts, but would like to know, for example. So the whole goal of a heat-ready school is to create schools that are increasingly able to identify, prepare for, mitigate, track, and respond to the negative effects of school ground heat. So that means school ground, meaning indoors and outdoors. So we want to improve safety and then optimize the child's experience. And this is part of not just heat-ready schools, but we have heat-ready cities that Phoenix is leading the charge on, and then heat-ready neighborhoods. And so we have key action areas around policy, environment, training, prevention, and community. And we meet with schools and provide curriculum and provide resources if they want to become a heat-ready school. We can go and give them these posters, and they have heat-ready champions, or the students might do this to figure out what are they doing to be heat-ready and what are things that they could be doing to be heat-ready, especially that are more low-hanging fruit. What are long-term initiatives that they might have? And then maybe it's a tree planting to provide more shade for kids outdoors, and we'll help them find those resources. So they all have this rubric to work with, and then all of these different resources that we created, and publication, and working with ADHS on this on a pilot version. But you'll get these slides in case you're interested in learning more about that. I think this quick example, we're working with a school to redesign their outdoor play space. I'm going to skip that slide. We co-evolved these goals, but we took their play space in South Phoenix and did a lot of infrastructure upgrades with respect to bioswales. They had flooding issues, trees, hedges, input, school gardens, a lot more shade brought in. And it's hard to see here, but because it was just the first year it was put in, but there's a lot more trees and hedges protecting them from the elements, whether it's heat or air pollution, in the spaces that these kids play next to a very busy roadway. So it's hard to just pick up the school and move it when it's put next to a busy roadway. So what can we do with it there to mitigate the heat and air pollution exposures that the kids might be experiencing? And so as part of that, we're monitoring the microclimate with temperature, air pollution sensors over the long term, and trying to see what changes might be made. We have some community-based projects going on where, for example, the Sagrado Galleria along Central got this really cool obelisk, and this obelisk lights up different colors based on the PM 2.5 levels from our air quality sensor on the Sagrado Galleria. So it's a way to bring the invisible to make it visible to communities and to start conversations. So if you're ever driving that way, I think the obelisk is up now and it should be connected to our sensor now, changing colors depending on the levels of air pollution. And last project I want to say is City of Phoenix. Who's seen or heard of the Cool Pavement pilot program? Yeah, where you can kind of see in this image that the City of Phoenix in 2020 started coating some of their roads a whitish gray, light grayish color. The whole goal was to try and reflect sunlight back into space so that we have cooler temperatures in the urban environment. So I was on the project team at ASU that led a couple huge field campaigns on this. They initially did it in 2020 across 36 miles of roads in 8 different neighborhoods. And remember, streets have to be coated all the time. And so instead of coating it with the dark asphalt, they're coating it with this lighter asphalt seal, you could call it. And it is supposed to have better performance. And so we're testing some of that performance and then the heat metrics around that as well. It is more expensive though. So this is the question the city has, is it worth our investment? So the whole goal is that with darker asphalt, as the sunlight comes in, it's going to hit it and a lot of it's going to be absorbed and that gets re-emitted largely overnight. That's why we see nighttime urban halogen effects. With the cool pavement, the sunlight hits it and it gets reflected back up to space as long as nothing intercepts it on the way. Meaning if a tree's in the way, if a building's in the way, if other shade is in the way, it's not going to work the way it's supposed to. So a lot of neighborhoods got the coating, and in 3 of the neighborhoods, we looked at areas with the coating, which is the blue section here. This is the Garfield neighborhood, and areas without the coating to do a direct comparison. And when we did this Garfield neighborhood, we saw it was 114 degrees that day. And we did this test morning, middle of the day, afternoon, and then after sunset to see what is the impact of this on air, surface, and mean radiant temperature throughout the day. So, and this is really, so we have this Parachute Earth. They wrote an article on our recently published article, and I love these images to convey to the public more what the findings were. So with surface temperature in the day, we know it's lower, and at nighttime, it's slightly lower compared to asphalt. Air temperature, we don't see much change, and at nighttime, we see only about a 0.5 degree Fahrenheit cooling. So it's not much for air temperature, right? And the city was really hoping this would reduce air temperature. With mean radiant temperature, and what we're looking at with mean radiant temperature is when you're walking across a road, what are you experiencing from the road in terms of reflected radiation and emitted long wave radiation, so heat? And what we see in the daytime is the mean radiant temperature goes up, which increases the solar heat load on people, which is exacerbated in the day, which can actually cause problems for heat exposure. And then at night, not much change, but not much difference. So what we say to cities or planners thinking about where to put this is we say, just don't put it in parks, playgrounds, or plazas, because we don't want to put it in places where people have high foot traffic and are walking throughout the day. Some people don't like it because it's blinding or gets really dirty. But the main thing is that if we want this to reduce people's experience, like heat exposure, that's not going to do that if you're going to put it in a place where people are running around in the middle of the day or walking around or trying to enjoy their day. But put it in residential areas that people aren't going to be walking down the middle of the road and can have shade on the sidewalk, then that's okay. If you put it in a downtown city area where there's tall buildings, it's going to hit the ground, the sun will hit the ground, and it'll just be absorbed by the building right beside it. So there's no point in putting it in a downtown city area either. So there's a lot of nuances to this where it's an interesting place to be in, where the industry companies come in and say, this is like a silver bullet to heat mitigation. And us researchers are like, no, it's not. And then we're trying to work with the city of Phoenix to figure out where is best to put it to get the benefits that they would like to see versus cause unintended consequences. My final message, and because I know this is a group that cares a lot about people's health and vulnerable populations, we see a lot of issues of pediatric heat stroke, so babies being left in cars and dying. And the graph in blue, and we've seen 942 since 1998. What happened in 1998? They put airbags in the passenger seat, and therefore car seats had to be moved to the back. And then people kind of started forgetting by accident that the baby was still in the car. So it's a really sad situation. Over 50% are forgetfulness, and there are new technologies and mechanisms to protect this, but all of these are preventable, right? And some of these are on purpose. Like mom wanted to go shopping and left her baby in the car and didn't think it was going to get hot, or thought the shade is just as good as or better than in the sun, which after 30 minutes it's not. And one of our studies showed that. So you can see 2022, just the variability, none in Arizona, which is really great to see, but there's a lot of campaigns around this and a lot of advocacy groups to protect kids. You can see how COVID resulted in less deaths, and that had a lot to do with people not going out as much and not having to go to work and then remember to drop baby off at daycare on their way to work. So there are some really sad situations that even the best parents forget about, but there's technologies available in car seats and cars now. And even like when I drop my son off at daycare, I have to sign him in. So my husband gets the notification that he's been signed in. And then I look to make sure my husband remembered, right? So there's all of these newer things in place to try and prevent these deaths. But main thing is in Arizona, we have the Good Samaritan law where you can, if you see a baby left in a hot car, you can get them out, and you want to call 911 first right away and get permission if you would like, and then get them out of the hot car. I don't know how it works for dogs, but some places have that for dogs too, where if you see a dog left in a hot car, you can get them out as well, but you want to call 911 first as well. So that's always my final message, especially as we're coming into the heat season, to protect kids in hot cars, because it is a really sad situation. Thank you.
Oh my goodness. Thank you so much, Dr. Vanos. I do not see any questions in the chat yet, but if anybody would like to add any there, they can. And then for those of you in person, anyone want to ask a question, and I'll run the microphone around.
Or comments. I'm open to comments.
So much good information.
Or input. I like learning from you guys too.
I just wanted to ask, as students, what kind of opportunities do you recommend we look into if we want to get involved with something?
So you mean involved in more education in this space?
Education or volunteering or
volunteering. Yeah. So if you're really interested in the heat and volunteering, the City of Phoenix Heat Response and Mitigation Department has volunteer signups where you can help with their outreach. And their outreach is either think about Human Services campus or general street areas, or sometimes on the weekends they'll go to Piestewa Peak and Camelback, where people still hike and try and prevent helicopter rescues, because it's very costly. And people have, I think someone died on Camelback Piestewa. So someone died last year hiking, and then there was a helicopter rescue on Camelback. And so that's that's one thing. And I think you can just type in like volunteer for City of Phoenix, and then you choose what you want to volunteer in. So that would be great. I don't know if Creighton has much, but U of A and their medical school has a lot of outreach stuff that you could try and get involved in that I mentioned briefly, where they're trying to help with that. There's some certification programs where you can be certified to go kind of door to door to check on people too on the hot days, or you can see if you can volunteer at a local cooling center too. In terms of education opportunities, a lot of schools now are creating climate and health like side certifications as part of medical school or other training for their students who are really interested in this, but it's not generally part of the curriculum. I think Columbia might be doing this. I think Colorado, I've taught in their climate and health program for their med students, and then New Mexico. So that's becoming more common too, where I don't know if you have to be a student there already, but trying to find opportunities if this is really of interest to you and you want to implement it in your practice in the future too, to learn about that.
And maybe Dr. Vanos, you and I can work together to get some of those links and information, and then we can get those out to on the follow-up email and out to the students.
For sure.
That'd be awesome. Yeah. Good question. Anybody else?
I have a question, or actually two questions. So really nice talk. The first one is, what's sort of the status of in Phoenix of you know, where to go when it gets really hot? I mean, do you have, you know, specific buildings that are, you know, cooled or have backup power where they can stay cool if there are power outages? Just kind of curious on how that works. And the second one was that about the reflective coating. Is that required now, like on rooftops, or do you still see rooftops that have, you know, sort of black asphalt?
Good questions. Okay, so for the first one, or actually, actually, I'm forgetting. Remind me the first one again.
Buildings that they can go to.
Oh yeah, cooling centers. Yes. Okay. The county has a whole heat resilience working group, which you guys could be part of if you wanted. I'll share that link, where meteorologists and different cities and then NGOs or libraries and churches come together and learn about how they can open a cooling center. But the most important piece is that we have cooling center maps that say, here's where you can go to seek cooling, and here's when they're open. Phoenix is probably leading the charge nationally, or even especially across North America, for having cooling centers that are open to anyone, accepting animals too for a lot of them, and open longer. And some cities might close at 3 or 4 because the library closes or so forth, but cooling centers are trying to stay open longer because it's hottest in the day at 4 p.m. here. So we make those maps available. They're available online. When you're going around and doing the heat response, we're giving those maps out, or we're saying, did you know you're near a cooling center? If you want to go get free water, cool off for a couple hours, clean up a little bit. And then in the cooling center, there's going to be resources and people who can help if you're looking for a job or ways to find housing and so forth. Cooling center, yeah, there's a lot of effort put into this, and I don't know how many we have open, but I'll include that in the links I share. And then second question, so I don't know if the reflective coating is required on roofs now. It might be. The reflective coating on roofs is great. People aren't spending too much time on roofs, and then you can make the solar reflectivity of that like 90% if you wanted, because you're not going to be blinded by it. On the roads, it's definitely not required. I would say they're still in the pilot phase. They're doing a bunch more neighborhoods this year. They did a bunch more neighborhoods last year. It's definitely not required. They're still figuring out how they want to move forward with this. And when that's put down, the solar reflectivity is about 35% and declines pretty quickly because traffic makes it so dirty. And so it's still like, how well will this work long term? And is it better than the alternative is a big open question.
Great, thanks.
Yes. So you said that predictions show an expected increase in mortality with climate change and global warming. And you mentioned that developed countries are faring well due to adaptations. Can the same be said for countries that might have less resources right now?
So it's hard to know because of that initial map I showed where we don't have mortality data. And so then we're not sure. So we need more studies and we need more mortality data in those locations. But in general, no. If we have like some cities, like thinking about like Ahmedabad in India and so forth, have better data, or Delhi, we know mortality has been really bad there, and they don't have the same adaptive capacities in a lot of locations as we might in more developed countries. But it's highly variable in terms of who's exposed and what they're doing when they're exposed and all of this. But there's a lot, yeah, we don't know. And if the projections only include as air temperature changes, then mortality change, or like that the only factor that causes death is air temperature, then we're missing a huge piece of the puzzle around who are the people, what is their age, what's their vulnerability. So some studies are then trying to incorporate adaptive capacity into it, age, and so forth to figure that out. But that's still developed countries mostly that we're relying on the past data to predict the future. So it's tough.
We are out of time, but let's thank Dr. Vanos one more time. And we appreciate you being here.